Well, hello, a good day, and thank you very much for having me again here, Jason. My name is Dr. Dietrich Gorman, and just a little bit about me. I'm actually a family medicine physician, actually going on 17 years. I'm originally from Indiana, and I currently live in West Texas. A little bit more about me. I'm a Pisces. My favorite color is blue, and I'm a dog lover. What I typically do is talk about stress and how stress affects the body and what you can do about it. But I am still a physician, which leads me to why I'm here today. I'm going to be talking about urinary tract infections. We're going to be talking about the urinary system, urinary tract infections in general. Of course, we're going to be talking about some statistics, some signs, symptoms, diagnosis, treatment, prevention, and a few other things as well. And I hope you really find that this will be informative. First off, let's start off with a picture of the urinary system. We have the kidneys, we have the ureter, which are these two long tubes that actually exit the kidney and enter the urinary bladder. So the ureter connects the kidney and the urinary bladder. And then we have the urethra, which is actually the opening into the external environment, right outside of your body. Just a quick look at the kidneys. The major role of the kidney is to actually filter excess chemicals and waste from the blood, which enter through the renal arteries. So they're right here. You can see the renal artery is red. So all that, waste and all that stuff goes in through the renal artery. But these wastes are excreted or extracted from the blood, and then they're formed into urine, and that's what we urinate out. The kidneys are also wonderful at regulating electrolytes, regulates the blood volume, the blood pH. It actually produces hormones, which is really like amazing. I mean, just in general, the human body is amazing. Okay, then looking at the bladder, the urinary bladder, this is a closer look of the urinary bladder. This is the body's storage tank for urine. And either by reflex or a conscious decision, this is where the urine will be released. So average urination, you can urinate about 6 times a day, but it will actually depend on, how much you're drinking. So anywhere maybe between 4 and 10 times a day is considered normal urination in a 24-hour period. And like I said, it depends on how much you drink. In a day, a person would normally drink about 2 liters of fluids, given a healthy person, but you can actually urinate from anywhere, let's say like 800 milliliters to 2,000 milliliters, which is 2 liters. What you put in, you can put out. And I mean, so it has a great storage capacity. Okay, just a little bit of urinary statistics, and I might do a little reading on this part. The actual urinary bladder can hold about 2 cups of urine at given any one time without you feeling too uncomfortable. It can stretch, though. It has these receptors and it's lined with muscles where it can stretch. And then after that, the two cups, then you start to feel that urge, to have to urinate. Urinary tract infections are actually more common in women. It's estimated that 6 in 10 women will experience a urinary tract infection in their lifetime, but the risk is a lot lower in men, around 0.9 to 2.4, so like 1 to 2 cases per 1,000 men who are under the age of 55, and then about 8 cases per 1,000 men over the age of 85. And urinary tract infections actually do increase as we get older. Urinary tract infections are common in older folks. They're not very common, but they totally can happen. And in general, which is an amazing statistic I was reading, women are actually 30 times more get the urinary tract infection 30 times more often than men do. And this is due to the anatomical differences. So going back to that picture, if you can remember, the urethra, which is the opening from the bladder to the outside world, is shorter in women and actually is closer to the vagina and is closer to the rectum. And so that's why women, due to anatomical differences, can actually be at an increased risk of having more urinary tract infections. What is a urinary tract infection, right? That's why we're here today, right? So it's any part of the urinary tract, including the bladder, the urethra, and the kidneys that can have an infection. And you can see this picture. This is just a graphic of what this looks like. Causes of urinary tract infections. So urinary tract infections are usually caused by bacteria. They enter the urinary tract, often from stool or from catheters. The usual bacteria is called E. coli. I don't know if y'all have heard of that before, but E. coli is pretty common. And actually, according to the National Kidney Foundation, 80 to 90% of urinary tract infections are caused by this bacteria, E. coli. And for the most part, E. coli lives harmlessly in our gut, in our intestines, but it can cause problems if it enters your urinary system. Usually it occurs from stool that migrates, from the gut into the urethra. Like I said, it's a close proximity in women. And older adults are actually more vulnerable for urinary tract infections because of more of a weakened immune system, reduced hygiene, lower fluid intake, and then bladder control issues. So those are the main causes. Now, excuse me, what are the risks? Like I said before, older folks are at an increased risk of having urinary tract infections due to the waning immunity as we get older. And it's just regular age changes. There could be because of bladder and bowel incontinence. So imagine if you're running around with diarrhea, it's kind of a mess down there, and it's just the opening portal for that bacteria to get into that urinary system. Excuse me, catheter use. So a catheter is a little tube that's placed directly into the urinary bladder to drain the bladder if you aren't able to do it yourself. And even though it's a sterile technique when applied, you still have skin that's around the area that's on the outside, and skin has bacteria. You still have to use the restroom, and then your bowels still have bacteria in it. And so that creates kind of like a tract for that bacteria to go through that plastic tube and then go into your urinary bladder. Cognitive impairment. Older people with dementia are at an increased risk of developing a urinary tract infection, and this can lead to voiding issues for sure. And this is because of impeding personal hygiene. They may forget to do that, or they might actually need to be catheterized because they're not doing it on their own. Menopause is a reason, and I'll explain that later, as well as an enlarged prostate in males. Okay, what are the signs and symptoms of a urinary tract infection? You can have burning, that burning sensation, that horrible sensation. You can have frequent urination, but you can feel the urge, like you have to hurry up and go to the restroom, but when you go, only a little bit comes out. That's called urinary hesitancy. You can have pain or pressure in the back or in that lower abdominal area. You can actually have pelvic pain. You can see blood in the urine. Your urine can actually be dark or cloudy, or it can have just an off odor or a strong odor that's not really normal for you. You can actually see a little bit of blood mixed in that urine as well. Other symptoms, you can feel tired and fatigue. You can have these fevers and chills, nausea, vomiting, and you can also have what's called vaginismus. Vaginismus is basically involuntary muscle spasm of the vaginal muscles. And, I really feel bad if a person has all of these. I mean, talking about ouch, there's a whole host of signs and symptoms. You don't have to have all of them to be diagnosed with a urinary tract infection. I wanted to bring with y'all today something a little bit different. I wanted to start off with a case study. And this will help me to illustrate the upcoming slides. And by the way, these are fictitious names. I don't know these people. All right, so we have a daughter. Her name is Sally. She brings her mom in, who is 84 years old. Her name is Dolores, to the doctor because she noticed that mom has been acting a little strange the past couple of days. Sally has become Dolores's caregiver, and she's new to caregiving. Dolores has mild cognitive impairment, but she's usually pretty much with it. She's independent at home. She's mobile. She does cook and clean for herself, and she takes her medication. Sally does come in daily to check on her mom to make sure there's nothing that needs to be done, or to see if there's any household chores or things that needs to be tidied up. But she knows that her mom does have a history of incontinence because Dolores doesn't drink too much because she wants to avoid accidents. Medical history is Dolores has high blood pressure or hypertension, some urinary incontinence, and mild cognitive impairment. She's had her gallbladder and her appendix removed. She's had 4 children delivered vaginally. She is a widow, a non-smoker, non-drinker, and she's a retired accountant. So, she was really with it back in her day. She's a retired hiker, so you can tell she was very mobile and active. And she was actually the past president of her local hikers association. It just so happens that Sally brought Dolores to the clinic the day that medical students are doing their training, and it's their first day of their clinicals. And this medical student's name is Dietrich. So reported by Sally, mom can get a little bit forgetful, but she can normally answer her questions okay. So student Dr. Dietrich said, well, what do you mean she's acting weird then? And Sally says, well, she keeps asking when his Wheel of Fortune comes on. And mom knows that she's been watching Wheel of Fortune for years, so she should know what time it is. Sometimes I have to ask her when Wheel of Fortune comes on. Also, she seems a little bit off balance. She doesn't normally use a cane, but I got her one because of this. Also, her appetite isn't the best. She normally eats pretty well. And ever since we ate at this restaurant, she's not been eating too good. She had mom or Dolores had the fish taco or fish nachos, and Sally had the burger. And Sally also notes that her mom, she's had 4 episodes of loose stools after that. Ouch. So in the clinic, Dolores says, I'm okay, I'm not hungry, and when does Wheel of Fortune start? That's all she's worried about. The physical exam, you see her heart rate is at 92, blood pressure is not too bad. Her temperature is 99, it's a little bit above normal, but not too bad. Respirations, weight, and height are normal. Student Dr. Dietrich notes that she's not really in any acute distress. She does appear to be weak, but not pretty alert for the place or the day of the week that it is. Her mucous membranes are dry. She has a little bit of a dry mouth, but her heart rate is normal. It's getting up there because normal heart rate is up to 100. Her lungs sound clear. Her belly is soft. Her bowel sounds are a little bit increased, and actually that would make sense for the diarrhea. There's no lower extremity swelling. Her skin is a little bit dry, unsteady gait, and she's using that cane, but there's no drifting or other significant findings. So medical students, when they see a case, they need to go back to their attending to present the case to make sure they're on the right track. She tells the attending the history and the physical exam, and student Dr. Dietrich says, oh my goodness, I want to send her for a head CT. Maybe she had a stroke. She's not talking her normal self, and she's a little bit unsteady. And then the attending says, well, what did the urine say? Or did you check a urine? And student Dr. Dietrich replies, huh? So, urinary tract symptoms in seniors. So in addition to what I spoke about earlier about those common urinary tract symptoms and signs, in seniors, they can be a little bit tricky because for seniors, they can affect their behavior. So it can be missed because you're attributing to something more serious or more dangerous. And because it's, like I said earlier, because the immune system is a little bit decreased when you're a senior and not functioning at optimal levels, the symptoms can actually take a different turn and produce some actually unsettling signs and symptoms, such as confusion, disorientation, agitation, poor motor skills, dizziness, falling, and even sometimes depression. And these are all different. And if you're not aware of that, it's like, well, how do these symptoms have to do with having a urinary tract infection? Doesn't make sense. Well, it's just because when an older person, especially if they're more frail, if they're affected by any type of infection, it really kind of throws everything off for them. And so everything starts to suffer. And if a person already has some mild cognitive impairment, it can make it a little bit worse or present a little bit more worse. And a person can become what's called delirium. It's a temporary issue, but it causes more change in their cognition. Now, how do you diagnose a urinary tract infection? The most common way is a urinalysis. And this is a way that you just urinate in a cup, and they stick the little stick in the cup, and they can read. There's a machine you can put it in, or you can actually read it. There's like a guide where you can read it. So just briefly, the specific gravity actually measures the ability of the kidney to concentrate or dilute urine in the body. The pH plays a role in the acid balance because the kidneys regulate your acid balance. Protein, you really shouldn't see protein in a normally functioning kidney because the body resorbs that. Leukocytes, they determine if white blood cells are in the urine or not. And then nitrites, they're actually indicative that you're probably having an infection, and it's usually a byproduct of this E. coli bacteria, more than likely, because like I said, E. coli is like usually the main reason for urinary tract infection. Now, don't get me wrong, there's definitely other bacteria that can cause urinary tract infections. There's even funguses that can cause urinary tract infection like yeast, but usually it's E. coli that's the culprit. Then you have ketones, which are like the endpoint of fat metabolism, glucose, which really shouldn't be there, bilirubin, which can be an indicator of liver disease, and then the urobilinogen. And it is present in small amounts, but in large amounts, it can signify liver issues. So the ones that are highlighted there is kind of what we look at as doctors to be like, maybe there is some type of infection going on, and we should do something about it. And please keep in mind, I just went through a very, very basic interpretation of an in-office urinalysis. And one other thing to keep in mind is if we do see a positive urinalysis in the clinic, what we typically do is send it off for a culture. And a culture is done because we want to hone in on exactly what the bacteria is that's causing the urinary tract infection. And it takes a couple of days to get in. And so please keep in mind too, if this comes up positive in the clinic and you are started on like an antibiotic, it's usually what's called empiric therapy. We want to start you on something because you're having those symptoms, but you may get a call in a couple of days after those culture results are back, and the antibiotic may need to be changed because now we have something targeted and more specific what will actually kill that bacteria that's causing the infection. And that's what the treatment is. Treatments are usually antibiotics. This is the mainstay. The treatment duration actually varies by gender. In a simple urinary tract infection for women, the treatment is usually like 3, maybe 5 days. But in men, because they're so rare and they could possibly be a little bit worse, in men, the treatment duration is usually at least 7 days long. And just keep in mind what I said about you may have to change that antibiotic once the culture results are in. Symptomatic treatment. We've all heard of the AZO or AZO. People call it AZO, as well as the heating pad. Now, the AZO is a product that you can take. It kind of like numbs up the urinary tract so it's not burning so much. If you're having those horrible symptoms of a urinary tract infection, it can burn. So this kind of numbs the area while you're on your treatment. And quite frankly, a lot of people do get a lot of relief from the symptoms, and they mistake that as being a treatment or a cure. It is a symptomatic treatment, but it is not a cure. So you should only take this about a couple of days, but this is not to be taken instead of an antibiotic. It's just to help calm things down while you are being treated. So please still get treated. Because I used to get patients of like, well, I really don't have symptoms anymore. I really don't want to be on any antibiotic because I took that azo. That is not an antibiotic. It will not treat it. Okay, so I just want to hone in on that. And then the heating pad, you can put it on your lower back if you're having, some pain, or the lower abdomen, just to kind of soothe some things. But just please be aware of the temperature because you don't want to cause any burns. Now, I know you all are in suspense about what happened to Dolores, right? The student, Dr. Dietrich, ordered the urinalysis, and what do you know? It was abnormal. Her specific gravity was elevated. This is the abnormal reading, so it means she was concentrated. There was a trace of blood, which means there's some inflammation in that urinary system. The nitrites were positive, and the leukocytes were also positive. So it's like, boom, Dolores had that. Dolores did well. So not only was she dehydrated, because remember, she wasn't eating the best, and she was really trying not to drink too much because she didn't want those incontinent episodes, and she had that diarrhea. She did have a UTI. She was treated with the appropriate antibiotics, and Sally, her daughter, reported that she was back at her baseline, doing well, eating, and watching Wheel of Fortune. And Sally and student Dr. Dietrich now understand that the elderly can present differently for urinary tract infection, and it will be duly noted. Now, how can we prevent this? That's the key for diseases. We want to prevent things from happening, right? Drinking fluids. Try and get your 6 to 8 glasses of water per day or fluids per day. Keep things flushed out. Keep your urinary tract flushed out. Now, in the case of Dolores, she really didn't want to drink too much because she was having some incontinence, which is understandable. But if it's too bothersome, the incontinence is too bothersome, meaning you're using the briefs, you're urinating, every couple of hours so you won't have accidents, please go see a doctor. There's treatments for this. If it's interfering with the quality of your life, you should get treated for that. Don't not drink because of that. So please keep that in mind. I mean, we're human beings. We're made of water. We need water. So don't restrict that. Please drink your fluids. You also want to avoid holding your urine. If you have the urge to go, really try and go. Not only is it very uncomfortable to hold your urine, bacteria are so happy to just be staying in that urinary bladder, saying, oh, it's a warm environment. Let me just keep growing and multiplying. Thank you for not peeing. No, we want to keep those bacteria flushed out. Okay. One other thing is you can wipe from front to back, not back to front. What I mean by that is, suppose you've had diarrhea or you've had a bowel movement. You don't want to track that bacteria from the anus back into the area where the urethra is. So it's just like a welcome invitation for that bacteria, which is already there in the first place. You're just giving them an extra boost by doing that. You actually want to avoid scented products, scented feminine products, meaning you don't want to really douche. You're introducing you're altering the flora of the vagina by doing that. Scented pads or tampons, powders, deodorant sprays, bubble baths, scented oils that you're putting down there. All that stuff can actually change the flora and the pH of the vaginal area and cause problems. Okay. Another thing is that you can please take the full course of your antibiotics. Now, this is really a good one because, someone comes to the clinic, they get diagnosed with a urinary tract infection, they're given the antibiotics for like 3 or 4 days, and after a day, 24 hours, 36 hours, I feel so much good. Oh, I didn't need them. I just keep the rest of those antibiotics for later. Please don't do that. Okay, please just take the full course. There is a such thing as resistance, antibiotic resistance. And you want to take the full course so you can be sure that you take care of it. Okay? Now, another one is cranberries. So this is kind of controversial. I do have a study here. In 2013, there was an analysis of 13 different trials that concluded that cranberry juice and tablets, because some people want to take those tablets as well, did reduce the occurrence of urinary tract infections when compared to placebo in women who have recurrent urinary tract infections. But, and I say but, there was another study that found that they didn't. So it's like, well, what do we do? So in addition to questions about cranberry's effectiveness in preventing urinary tract infections, the actual amount that would need to be taken is really not set in these supplements, because the premise is by drinking this cranberry juice or taking these cranberry supplements, it's going to hopefully help prevent the bacteria from sticking to the walls of the bladder. So that's the premise of it. But I guess they're saying that, there's not actually enough of it in these supplements to do that. However, having said that, the experts say, well, it's not going to hurt you to do it, so you can go ahead and do it, because just in case it does help. So it won't hurt you. It could possibly be a benefit. So, if it makes you feel better and if you think it's helping, it's not going to hurt anything. The risk of harm to you is low. Another way to help prevent is probiotics. Probiotics are the good bacteria. And so what you can do by taking that, it can help normalize or give you more of those good bacteria that are going to fight the bad bacteria. Now, this is in the vaginal area. This is also in the GI system. So I think probiotics are good. A lot of people should be on them, especially also if you've gone through a round of antibiotics. Sometimes the good bacteria and the bad bacteria are both killed. And so you want to kind of just replenish those good bacteria and kind of go back to your normal state. One other thing you can do is urinate before and after sexual relations. Again, you're just flushing out the urinary symptoms or the urinary tract with the bacteria, because now you have someone else's flora involved as well. So you want to just get that out as best as you can. And then estrogen. So this is different. Topical estrogen. Menopause actually decreases estrogen levels, which may actually disrupt the balance of the vagina. And like a low dose topical estrogen cream can actually help restore the balance. And so that's why it's actually could be beneficial for that to be used. It helps normalize the vaginal pH. Okay. Now this is a topic that I'm going to briefly touch on, because you may have heard cystitis and urinary tract infection used interchangeably. They can be similar, but they're not exactly the same. Cystitis, so anytime you see an itis at the end of something, that just means inflammation of. Cystitis means inflammation of the urinary bladder. Now, it can be caused by an infection. So infection can definitely cause the irritation that I talked about earlier. But the urinary bladder can also be irritated or inflamed by other things, by other irritants. Some of the symptoms can be the same, such as a big urge to urinate, pain with urination, blood in the urine, strong smelling odor, cloudy urine, that lower pelvic discomfort that you have, and you can even have a low-grade temperature depending on what it is. So there's a thing called foreign body cystitis, meaning, for example, if there's a Foley catheter placed into that bladder, it is a foreign body, it can cause some irritation of that bladder. So that's a type of cystitis. There's a chemical cystitis, and that is like if a woman has been using feminine hygiene products or sprays or even spermicidal jelly, because they are chemicals, and sometimes if it gets in there, it can cause inflammation or irritation of that bladder. And it's not necessarily an infection, it's just that irritation. There's radiation cystitis, meaning some medications that are used for chemotherapy can cause some irritation of the urinary bladder. Also, cystitis can be associated with other conditions like kidney stones, enlarged prostate, diabetes. Now, pyelonephritis. This is what we're trying to avoid. out of all this talk, we're really trying to avoid pyelonephritis. And pyelonephritis occurs when infection actually makes its way up through the ureter and into the kidney itself. And this can actually be very serious. You can have the fevers and chills, the sweats. I've seen like severe back pain, elevated temperature. They're just sweating, pouring down sweat. They're just like in bad shape. And it's usually more severe symptoms than what you may see with a typical urinary tract infection presentation. You may actually need to be hospitalized and get IV antibiotics for pyelonephritis. And concerning the elderly, more than likely, you will be hospitalized, and this is just to monitor, because things can really go south pretty quickly, especially if that infection kind of gets into the blood and causes sepsis, which is a whole nother talk, and it's a whole nother can of worms that we're not going to talk about today, but it's a very serious infection that can develop if that bacterial infection gets into the blood. In the hospital, you will definitely get a blood culture. You'll definitely have a urine culture. You will get blood work done that may indicate that you do have this infection, but it's usually a few days hospital stay with IV antibiotics to really knock out that infection. And that's really what we're trying to avoid. Okay, so my summary, my takeaway from this is urinary tract infections can be a pain, right? They're not fun, you know, they're disruptive in your life, especially when it's very painful. You don't have to have all of those symptoms. You may just have one symptom and you're positive. You see what I mean? You may just have that extra urinary frequency and a little twinge of burning when you pee. So that could be something. Another takeaway is to hydrate. Get your water in. We are made of water as human beings. Encourage your loved ones to drink water, even if they are concerned about incontinence. Just go see your healthcare professional to take care of the incontinence if it is disruptive in your life. But we need to drink the water. Our body's biological mechanisms need to occur in water, and we just really need to hydrate. And we need to have good kidney health as well. Also, in the meantime, before you do see a physician, you know, go to the restroom every 2 to 3 hours while you're still awake, so that you can decrease those episodes of incontinence. And right before bed, urinate 2 to 3 hours before you go to sleep. Don't drink. So those are some things that can help if incontinence is an issue and a reason why some of our elderly don't want to drink. And then also one other thing, the drive to drink fluids or hydrate does decrease a little bit as we get older. So that's like a double whammy. So just water is important, just hydrate. Also, what we've learned here is that elderly people can definitely present differently when they have a urinary tract infection. And to be honest with you, they can present differently when they have any type of infection. So please be aware, educate yourself that elderly can present a little bit different. If you find your loved one acting a little bit different, make sure that when you go to the doctor, they are checking the urine, they are checking some of the simple things before we start ruling out the bigger things. Now, for sure, some of the bigger things like, you know, stroke and all that stuff pneumonia, all that stuff can happen. But start off while you're there. Let's tick off the simpler things that are treatable before we go chasing the bigger things. And then also, the takeaway is finish your treatment. If you've been diagnosed with a urinary tract infection and you're feeling good after 24 hours, I'm so happy for you, but still finish the other 2 days. If you're a man, finish the 7 days, please. We don't want resistance. We don't want the urinary tract infection to come back and then you get into that recurrent urinary tract scenario. So we don't want that to happen. Just please finish your treatment course. And then prevent. As with anything, any disease or infection, we want to prevent it from happening in the first place. So please, you know, do some of the steps that I mentioned. And then the main thing is to stay hydrated.
If an individual or a caregiver for a loved one believes there's a UTI, do they go to their primary care? You mentioned a urologist. What's the differences between what your primary care could do versus a urologist?
Excellent. So First off, if you feel that you have any type of symptoms of a urinary tract infection, please try not to wait to get it checked out. Like I said, don't mistake the azo for cure. So go get it checked out. Go to the doctor's office, get the urinalysis. So what a urologist is a doctor that specializes in the urinary tract system. So, as well as the male reproductive system. So a urologist would actually, if a person like gets recurrent urinary tract infections, a urologist will be able to see them because they can actually take a look in the bladder. They can use a cystoscope and look in the bladder. If you are having other urological problems such as kidney stones, that's where you go to a urologist, takes care of that. If you're a male and you have enlarged prostate, this is a urologist you go to. A nephrologist, on the other hand, because some people think they're the same, but they're not. There's definitely some intermingling, but they're not the same. A nephrologist is a kidney doctor. The nephrologist actually specializes in treating diseases of the kidney. Your urologist treats issues of the urinary tract system. So there is a difference.
Okay.
And I'm sorry, I wanted to say one more thing. If you feel that you do have a urinary tract infection and you go to the doctor, try and go with a full bladder if you can, so that you don't have to wait around to fill your bladder when you're there. And if you have a long wait, go up to the front desk and ask the attendant, can you please have a cup? I'm here for, urinary symptoms. I like to submit my sample now, so that you can go ahead and void it, and then they can be able to test it while you're there. I've had many appointments where they come in for urinary symptoms and they want treatment. And I'm like, well, I need something objective to go by. Can you give me a urine specimen? I just urinated right before I came in. Well, okay, here's a bottle of water. Let me know when you're ready. So there you go.
Very good. From a hygiene standpoint, are baths more beneficial to women than showers?
So no, I mean, taking a bubble bath, it is fun, it's relaxing, but again, sitting in that stagnant water, it can change the pH of the vagina and the vaginal area. Showers are basically cleansing off everything. You're washing off the dirt, you're washing off the bacteria, whatnot, and then just kind of staying in that tub. It really isn't the best for a long time, or especially if you are having multiple urinary tract infections. So I guess I would say, if you just really are just adamant about taking a bath, take your bath and then maybe take a shower and just kind of rinse the water, off in between yourself, and make sure there's no soap or anything there that can cause some extra irritation.
Very good. Last question. Does the use of diapers for incontinence create a higher likelihood of a UTI?
That's a really, really good question. And I would like to say, yes, it does, in the sense that, especially if you're not frequently changing the adult diaper, that urine and the feces are just sitting there, laying there. The bacteria is there. It is touching the skin. And so, yes, I would say that it can increase that risk of having a urinary tract infection. So whenever there's an accident, if there's products in the diapers, you want to get the person cleaned up as quickly as possible. And I mean, I know they're convenient, but they can cause problems as well. They're more of a convenience for the person and the caregiver, but they can lead to problems.
Yeah.
So yeah, definitely frequently changing. You can reach me, you can email me at drdeitrickg@yahoo.com, DRDEITRICKG@yahoo.com. You can find me on all social media at Dr. Dietrich G. So I'm on Facebook and Instagram, YouTube. You can messenger me through there, or you can even visit my website at drdietrichg.com. I did want to leave all of the viewers with a free gift. It's a free ebook, 50 Ways to Treat Yourself Well. No matter what your budget is, you can find ways to treat yourself well. So please look at this website. I do ask for your email address if you want to get on my email mailing list. That would be great. But this is a great way to treat yourself well. I am having a conference that's coming up, and it's called the Professional Women's Relaxation Conference. It will be June 16th and 17th. It's going to be in Odessa, Texas, at the Downtown Marriott. And this conference is actually geared for professional women to learn about and actually arm themselves with tools to better manage their inevitable life stressors. It's going to be fun and it's going to be engaging. There's going to be talks. There's going to be a professional women's keynote lunchtime panel, and it's going to be great. There's going to be breakout sessions as well. So for the folks that are in Texas that are listening, or even if you want to travel to Texas for a mini vacation, this will be a great conference to learn about stress, what stress does to you, and ways that you can take care of that. So please sign up.
Excellent. And by the way, thank you, Dr. Dietrich. It's so good to see you again. Hopefully we'll get you back. I know we were talking about a couple more webinars in the coming months, so we're looking forward to having you back. As far as Knowledgeable Aging, you can go to our website, knowledgeableaging.com. Also encourage you to go to YouTube, type in Knowledgeable Aging, subscribe. We update that as frequently as we can. If podcasts are your thing, you can find us on Apple, Tunes, Spotify, etc. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.